This is Diabetes in Children, Part 2, and we're looking at the different types of insulin. And as I was saying, with kids, we pretty much are trying to use just the rapid-acting or short-acting. We're having them take an injection for the one meal each time they eat, rather than trying to estimate you're going to need this much at lunch and mix, the one for breakfast with one that'll peak later for lunch. It's just not good enough control. So we're trying to do all fast and rapid acting. Short and rapid. We are still worried about those same complications. These all happen from high blood sugar over time, destruction of the vessels that interfere with vision, kidneys, increased lipids, hypertension, problems with the GI like celiac disease, problems with other endocrine systems like hypothyroidism. So our teaching points with our kids with diabetes, we really want them doing as much self-care as possible. And I'd say kids by 8 or so are doing the majority of their care. Parents are overseeing it, but kids are doing it. They've got to do those finger sticks for their blood sugars. We are doing it every meal and bedtime because we're using a lot of injections. Urine ketone testing, we usually send a package of the ketone strips home with the child to be able to test their urine, but that's not something we do on a regular basis because your blood sugar's got to be pretty high to spill any ketones into the urine. And so we do use it, but not on a regular basis. Their medications, they've got to understand their insulin, both how it works and how to give it, how to draw it up, how to give it. We want to make sure they understand signs and symptoms of hypo and hyperglycemia. And just for all of us, if somebody is a diabetic and they're a little off and not making sense and they're still conscious, but they're really disoriented, we are going to treat them as hypoglycemic. It's always better to treat someone as if they were hypo, give them something with sugar, some orange juice, some candy. And if they're high, well, you didn't help them, but you didn't really do anything horrible either. But if they're low and you don't treat them, they're going to get worse, possibly lose consciousness, possibly have seizures, possibly die. You die quickly from hypoglycemia. So we're always going to treat as hypo if we're not sure which it is. Monitoring and managing complications, sick day instructions. This is pretty tough because if you're sick and you're not eating, you'd expect your blood sugar to be lower. You just haven't ingested the amount of carbs. However, if you're sick, those stress hormones, the cortisol, makes your blood sugar go up, right? Makes your body release the stored sugar. So it's hard to say. They certainly will still need some insulin on a sick day, even if they're not eating, but it may not be as much. It may be more. We don't know. They've got to do closer monitoring on a sick day. Lab testing and follow-up, just like with adults, we love that hemoglobin A1C. It gives us a 3-month picture, so they think they've tricked us by doing a great job the day before they come to the doctor's office, but we can see. And anymore, we've got the home glucometers. Keep a history, so it's not just trusting the child to write things down accurately. The equipment's just, electronics have gotten better and smarter, so we can usually see that way as well. Diet. What we're doing with kids, and I think they're starting to do with adults as well, is do more carb counting than put you on just a 2,000 calorie diabetic diet and tell you never drink soda, never eat cake. We let kids go to birthday parties occasionally and have some cake and ice cream occasionally and just take the extra insulin to cover them for that treat that day. So what we're doing is having them look at their plate, look at what they're going to eat, count how many carbs that is, and then translate that to how much insulin they need, plus the insulin they need for their basal metabolic rate based on their blood sugar level, and give themselves that insulin. So we're having them do it every meal rather than use those longer acting or intermediate acting insulins. And we can control things better that way. We can also let them have a little more normal of a life. Exercise, we want kids exercising. Kids are supposed to go and run and play and be on sports teams and all those things. But the more you exercise, the more sugar your cells use up. And so we do want kids to be keeping, a juice box or some candy or whatever in their bag when they're exercising in case they start to feel symptoms of hypoglycemia. So here we are showing this child how to do self-blood glucose monitoring. And here is giving himself an insulin injection. And this really is what we're using more than anything else, the insulin pen. And these do come in all the different types of insulin. You twist this back here, and there's a little box somewhere that has a number inside it that tells you 2, 3, 4, whatever, the units of insulin. So you can't make a mistake trying to draw it up. And then they give it, you push the back sort of like a pen to administer it. And I said, I mentioned the insulin pump before. We get them onto multiple injections every time they're going to eat, and when we get them pretty stable that way, our goal is to go to this insulin pump. And so we've kind of figured out what their basal need is, and we set the pump to give that constant little bit of insulin. And every time they eat, they look at what they're going to eat and punch in, give me, whatever, 6 units or whatever it is they need for the meal. The kind of latest thing is this continuous glucose sensor. And these things, they do go sub-Q, and they need to be changed every few days. I'm not sure what they have kids doing right now, but it used to be every few days. This is pretty new, and the goal is to get it just like your pancreas, that when this senses your blood sugar's up, it tells you, give a little bit more. And when it senses your blood sugar down, it says, hold off, stop. Right now, they aren't doing that. This instead is I think it vibrates so the person knows and checks their blood sugar, or I've heard some will go to their phone and tell them what it's reading, but we do want them checking their actual blood sugar to make sure that it's accurate. But that's the direction things are going. And their blood sugar is just much more fine-tuned by doing that. We used to not talk about type 2 diabetes with kids, but we are these days. So type 2, right, this is insulin resistance. The cells are not good at using insulin and getting the sugar inside that they need. So why? Well, sedentary lifestyle. Kids are sitting, they're watching TV, they're playing video games. The American Academy of Pediatrics says kids should not watch more than 2 hours a day of screen time, and that includes all of those things. That kids should be up and running around and doing active things. The other problem is poor diet. Kids are not eating healthy, balanced diets, and they're grazing all day long. So all day they're adding a little more sugar, carbohydrate in, rather than eating 3 meals a day. So kids can have snacks, but they should be nice, healthy snacks, and we really want to teach kids that eating is separate from sitting, being bored, that, mealtime are a good time to interact, to talk with your family, and then you go and you do things, that you don't just graze all day long whether you're hungry or not. A great resource is MyPlate, and kids can kind of do meal planning for themselves. Half of that plate is supposed to be fruits and vegetables. And this poor diet and sedentary lifestyle has led to obesity, and we know obesity is a big component of type 2 diabetes. Not for type 1, but yes, for type 2. We don't really want to put children on a diet and restrict their calories. Instead, what we want to do is get them eating a healthy diet and increase their activity. So here's the MyPlate. They're supposed to pick fruits and vegetables, grains, try and make half of that whole grains, and then protein. And so we can give them and then the dairies up here. Give them choices of what they're going to put on their plate and let them pick the things they like that they'll eat and make a healthy meal plan. And then increase their activity. This is best if they do it with their family. Kids want to be with their family. They love their family. So getting the whole family up and out, it's good, being a good role model for the child, and also is going to be a health benefit for everyone.